We recognise some people and communities don't have the same access to quality healthcare and experience ongoing poor health outcomes. In WA, some groups are at greater risk, including Aboriginal, multicultural, and LGBTIQA+ people experiencing socioeconomic disadvantage, and those who live in rural and remote areas. While not every person has the same experience, some groups are more likely to experience inequities in health and well-being due to things like lack of local health services where they live, stigma, discrimination, and unequal access to resources. Evidence shows that these people tend to seek treatment later, present to hospital EDs more often, face challenges in accessing preventative healthcare, and have poor health literacy. Accessing healthcare can be made more difficult when people are impacted by multiple social determinants of health. As the operator of WA's 3 primary health networks, understanding our underserved communities and the barriers they face is crucial. Health equity guides what we do, from strategic planning and capacity building to guiding and directing investment in primary healthcare services. Through our commissioned service providers, we can better understand the day-to-day struggles some people face in accessing the healthcare they need. Hear some of their stories. Jackson, 45, has been homeless for the past 5 years after losing his job. He has a history of untreated depression that manifests as sadness, lack of motivation, and hopelessness. He also experiences anxiety and panic attacks. He doesn't have many friends and doesn't see his family. Without a job or savings, he can't find somewhere to live. Through a community outreach program, Jackson was provided short-term accommodation at a hostel that provides in-reach services. He began attending therapy sessions and was prescribed antidepressants to help manage his symptoms. Jackson's depressive symptoms began to improve, and he's feeling more hopeful and motivated to change his situation. He was eventually placed in a supportive housing program that offers long-term accommodation and access to social services, allowing him to focus on his recovery. Melody, 22, has depression, social anxiety, and alcohol use problems. Experiencing childhood trauma, she has limited relationships with family and friends, and often uses alcohol to cope. Lately, she's been drinking more often, and it's starting to impact her performance at work. Melody started seeing a psychologist who worked with her to address her depression, reduce her alcohol use, and increase her support network. After her sessions, Melody experienced an improvement in her mood and well-being. She was drinking less and was in touch with her family and friends. She was linked in with community services, including a local GP, to support her ongoing needs. Sarah, 19, grew up in a low-income family in a small rural town. She often missed school to help at home, which caused her to fall behind. Growing up in a disadvantaged environment, Sarah developed severe social anxiety, feeling self-conscious and avoiding social interactions due to fear of judgment. To cope, she turned to social media and online forums, which provided a temporary escape but made her feelings of inadequacy worse. During a GP visit for regular headaches, Sarah's doctor noticed signs of anxiety and referred her to a free digital mental health service. Sarah enrolled in therapy to address her anxiety and an online support group where she found a safe space to connect with others. With time, Sarah's anxiety improved and she became more involved in her community. Inspired by her experience, she hopes to pursue a career in social work. These are just a few examples of the challenges people in our underserved communities face and impact the services we commission are having on their health and lives. As a commissioning body, achieving health equity means more than just funding health services. It's about ensuring the services we commission reach the right people and are delivered in a way that meets their needs.